Hi, I'm Gordon Heinrichs. It's a pleasure to be here today. I write medical books. I write books about healthcare. And today's topic is opioids and natural therapies. Are both good choices? The simple answer to that is yes, they are both good choices. But things aren't always that simple, are they? Nothing works every time. Let's say you have arm pain. And the arm pain is so bad you can't sleep at night, you can't do anything, you can't even go to work. It just consumes your mind. And so you decide to get brilliant. And you decide to cut your arm off. Well, is that the solution? Maybe, maybe not. There's a thing called phantom limb pain. You may have lost your arm, but you still may have the pain. Nothing works every time. How many people here know somebody who's taking the strongest drugs possible? Maybe they have cancer, heaven forbid. And yet they're still screaming out in pain. Anybody? Okay, a couple of you. Yeah, I know a couple of people like that. Taking the strongest medications and they're still in a tremendous amount of pain. And I often wonder to myself, I wonder if their doctors have tried everything else besides the drugs. I'm getting kind of a puzzled look on a couple of your faces there right after I said I wonder if their doctors have tried everything else besides the drugs, because I'm guessing you're thinking, if the strongest drugs don't work, what else could there be? And that's a very good question. And there is an answer to that, which we're going to get to in a few minutes. Before we get to the answer, though, we have to know about protocols, because protocols will help us lead us to that answer. Protocols are something that every healthcare provider, whether you're a massage therapist or a neurosurgeon, knows about. And they have to know about these, and they're very simple, so it's not that difficult. They have to know about them before they graduate or get their certificate, whatever it happens to be. So what is the essence of protocols? The essence of protocols is that, as a general rule, there's a predetermined sequence of events that takes place in healthcare. For instance, you use painless before painful, simple before complex, low risk before high risk, cheap before expensive, non-invasive before invasive, therapy before drugs, drugs before surgery, safe medication before harmful, and common treatment before experimental. And it goes on and on. Goes on and on and on. So it's not that difficult. All that's saying is you start here and you move to here if that doesn't work. So let's go back to that original question. Are there other options for pain? Before we get to the answer, though, we have to decide who the experts are, because we're going to be looking at things that the experts say. So who are the experts? We have to agree on the experts. So we're in the state of Washington here. And so if I'm choosing the experts, I might choose UW, University of Washington, yeah. If I was in Canada, I might choose McMaster University, right? Okay, maybe Mayo Clinic. Okay, who would you choose? Who would you say is at the top of the list as far as the best medical people? What institutions are they residing in? Duke University, Harvard, yes. Cleveland Clinic, yes. USC, UCLA, Stanford, yes. Johns Hopkins, absolutely. Okay, so that's enough. So we can all agree. I think we can all agree. When those names come up, we think the best, right? Okay, so let's see what the experts say. Let's see if the experts have written something about pain. The experts that we've chosen. There was a white paper that was written at the end of 2017. And white papers are designed to help us understand complex issues. And this white paper does a great job of that. In fact, it was reported on in the Seattle Times in 2018, so maybe some of you have seen it. Here is the title of the white paper. Evidence-Based Non-Pharmacologic Strategies for Comprehensive Pain Care, the Consortium Pain Task Force White Paper. Okay, now we're looking for experts. And we're looking for the experts that we said were experts. So who is this consortium? Well, here's a partial list of the people in the consortium. Stanford, Yale, Georgetown, UCLA, USC, Mayo Clinic, Harvard, Yale, Johns Hopkins, University of Washington. And in Canada, McMaster University. Yeah, so those are the experts. We should be paying attention. Yeah? It's sort of like Bill Gates writes a paper about computers. We should be paying attention. He has immediate credibility. The consortium wrote a description about themselves, which I think is very informative, even though it's quite long. And so I'm going to read that to you. This is a description about themselves. The Academic Consortium for Integrative Medicine and Health, the consortium, is a 72 North American institutional member organization. Wow, so there's a lot more, and I can guarantee you, you would recognize almost all the names. Organization of esteemed academic medical centers and health systems whose mission is to advance evidence-based integrative medicine and health in research curricula and sustained models of clinical care. There are two words I like to focus on. As you can see there, I highlighted them, two phrases. The first is evidence-based. So these esteemed academic medical centers knew that their opinion was extremely valuable. They're at the top of the list. You better pay attention to somebody's opinion who is the expert at the top of their game. But they also knew that their colleagues in the field valued evidence-based, research-based information more than opinions. And so that's the only thing they deal with. The consortium deals with evidence-based. So in the paper, in the white paper that they wrote, that's what it is. It's research-based information, evidence. The second word or phrase I want to look at there is integrative medicine. Integrative medicine is essentially the combining or the collaboration between conventional medicine and what I call natural therapists, you could call alternative care specialists. Now, they had several reasons in their paper why they wrote this paper. And I want to go over those first before we look at the strategies, because I think they're very important. The first is, the U.S. prescribes 50 times more opioids than the rest of the world combined. What I'm listening for there is your jaws to drop and hit the floor, because that's what happened when I read that. 50 times more opioids than the rest of the world combined. Unbelievable. And this is prescribed opioids. It's not off the street. Why would we need 50 times more pain reliever than anybody else? Good question. The strategies they have in their paper are safe and effective. You can't get any better than a strategy, a treatment that's safe and effective. You're going to go for it every time. They can be used standalone or in combination with medicine. Wow, so you can go to one of these offices where these strategies are, the people that treat, and you can stay right there. You don't have to go anywhere else. You don't have to go to the stronger drugs, let's say, or anything else. Or maybe you do have to go to another place, and maybe you do need some other drugs, but maybe you need Tylenol instead of the opioids because of where you first went. Additional benefits, they put these in there, and I thought they were worthwhile looking at. These strategies can reduce anxiety and depression. I'll go back to the previous slide here. If they can reduce anxiety and depression, maybe they can either eliminate or reduce the need for anxiety or depression drugs. Reduce nausea and vomiting. Wow, that's not good. Anyway, that is good, I'm sorry. Facilitate restful sleep and increase a patient's sense of well-being. You know, I feel better after just reading that slide. Let's compare what we just found out with what happens when you take opioids. What opioids can do for you. Obviously, they can relieve pain. We know that. They can cause sedation, dizziness, nausea and vomiting, constipation, increased sensitivity to pain. That's not a typo. Increased. Some people get increased sensitivity to pain. CDC says overdoses involving opioids killed more than 47,000 people in 2017, and 36% of those deaths involved prescription opioids. So 1/3, 1 out of every 3, about, they were taking their prescription opioids and they died. They overdosed. You and I are at risk by taking the prescribed drugs that our doctor gives us, if it's an opioid. The odds of long-term use increase most sharply in the first days of therapy, particularly after 5 days of taking the drugs. Wow. My son-in-law had shoulder surgery about 5 years ago. He took the prescribed opioid afterwards. He was in pain. In 3 weeks, he was addicted. Thankfully, it only took him about another 3 weeks to kick the addiction, but not without some trauma to him and his family. And then his daughter, my granddaughter, had leg surgery about 2 years after his surgery. She was sent home with 100 OxyContin tablets. 100 OxyContin tablets for an 11-year-old. Thankfully, she didn't need any of them. She took Tylenol for pain. I have a personal interest in the opioid crisis, and that's one of the reasons I'm here today. What are these strategies? Well, remember that they're comprehensive. That means, in this instance, in this context, that they're for acute and for chronic pain. So let's look at them. This is exactly it. I took them right out of the white paper. This is how they were listed. Acupuncture therapy and massage therapy are the first two in the inpatient acute pain list. Beautiful. I love both of those. Mind-body interventions such as music therapy. I love that because I can use my rock and roll to help me with my acute pain. Well, that's not exactly what they're saying, but remember, these are evidence-based strategies. So this is researched information. Strong research information that says music can be used to decrease acute pain. Now maybe rock and roll isn't one of those types of music, but music for acute pain, yes. Transcutaneous electrical nerve stimulation. That's a common treatment for pain. How many people here have used a TENS unit? It has little wires sticking out. It's usually a little black box you stick on your hip there. A couple of you, yeah, okay. It's a common treatment. How about for outpatient chronic pain? Well, they've got acupuncture and massage therapy at the top of the list again. Those are in fact the only two that are in both lists, the chronic and the acute pain list. Now that doesn't mean the only two that eventually will be in both lists, because remember, this is only evidence-based medicine, and apparently for anything else, there wasn't enough research done. But for these two, acupuncture and massage, the research is there for chronic pain and for acute pain. Chiropractic and osteopathic care. Well, what they're talking about here is manipulation. And I know a little about manipulation because I was a chiropractor for 20 years before I retired. When chiropractors and osteopaths graduate from their respective schools, things change once they graduate. The chiropractors tend to continue to practice manipulation, whereas osteopaths tend to go the medical route and don't practice manipulation. Therefore, if you're going to choose manipulation as one of your treatments for your chronic pain, it's best that you go to somebody who is practiced. Physical therapy. We all know about physical therapy. Mind, body, and movement therapies. Movement therapies. What might a movement therapy be? Anybody have an idea? Movement therapies? I'll give you a hint here. Yoga. Yes, you're right. Okay. Just don't tell my yoga instructor that I just made a pose like that. She probably wouldn't agree that that was the best pose. Anyway, yes, yoga is one. There's another one. Movement, Tai Chi. Yes, absolutely. Cognitive behavioral therapy. That's a mental health approach, so you're probably going to need a mental health specialist or therapist for that. Now, right after this list, the chronic list, there was a sentence, and I've shortened it here, and that sentence essentially said referral is recommended. Therefore, if you're in the hospital, for instance, and you're going home and you're going to have pain, or potentially going to have pain, you should be given a referral list of people that you can go to for your pain. What happens if they don't give you a referral list? Well, first off, they're not practicing the best pain medicine, are they? Because these are the experts, and they're saying a referral is something that should happen. Well, there is one other thing that you can do, and we'll get to that in a few minutes. Not only have these esteemed academic medical centers recommended these natural therapies for pain, for acute and chronic pain, but they've also incorporated them into their own health plans for the health and well-being of their own faculty, staff, and students. So let's see what Harvard says about that. Faculty of Arts and Sciences, this is for all members of the Harvard community. Who might that be? The end of that first sentence says students, faculty, staff, retirees, and university affiliates. That pretty much covers everybody. They want to get everybody involved in this. Can take advantage of the innovative programs and services. Wow, innovative programs. What are those innovative programs? Well, look below. Yoga, meditation, acupuncture, massage, and Reiki. They're not saying don't use conventional medicine, are they? They'd be out of business if they said that anyway. They're saying use collaboration. Go from here to here if you need to. Are you receiving the collaborative care, the optimal care that these patients are getting at these esteemed academic medical centers in your community? And this care is not only just for pain. These esteemed academic medical centers are also collaborating for many other illnesses and diseases. And if you want to find out simply what that looks like, is you can buy a book that I can recommend. I happen to have written it. It's on Amazon. It's an ebook. It's called Rise of the Natural Therapies, First Do No Harm. Why wait until after you've had surgery or an injury to initiate collaborative care? When you're in pain is not the time to be thinking about what your pain care is going to look like. Connect your family doctor with your acupuncturist, your chiropractor, your massage therapist, so they can initiate this care before you have a need. They should be talking to one another on a regular basis anyway, maybe over coffee, whatever. Before I close, there's one other thing we need to agree upon, and that is, who has value in the healthcare system? Who has value in the healthcare system? Is it the person who might eliminate or decrease the need for the strongest pain pills? Is it the person who might eliminate or decrease the need for drugs for anxiety and depression? Or is it the person who can prescribe the drugs? Think about it. They're both valuable, aren't they? They need to work together for best health for you and for me. Thank you very much.